I start by congratulating the Honourable Member for Swansea East for once again securing a debate on this important issue. And it's really good to see all four nations represented here this afternoon, and both men and women involved in the debate. It is actually my wedding anniversary today, Mr Robertson, and it's a pleasure to share it with the Honourable Member for Strangford to show our continued working relationship together. And can I just say to reassure honourable members here today that progress has been made since the honourable member for Swansea East debate last October. It was one of the first debates I took as a new minister, and I can honestly say virtually every day since then we've been working on many of the issues addressed in that, in terms of improving the outcome for women going through the menopause. And it's not just an important issue for me because it's one of my key priority areas in my portfolio, but as someone who went through an early menopause over 10 years ago, and the Honourable Member for Edmonton describes her struggle to get her GP to take her seriously, when you're in your 30s, it's even more difficult. And it can be a very lonely experience if your peers are not going through the same thing, who they're busy getting married, having children, and certainly not talking about hot flushes and not being able to sleep. It can be a very, very difficult experience. So for me, it's a personal mission as well as a ministerial one. And I want to reassure colleagues in the short time that I have that I'm absolutely got a laser focus on delivering many of the pledges that were made in the Honourable Lady's debate. Firstly, on the cost of HRT, we did announce in that debate we would accept the move to go towards it, reducing the costs. It only affects women in England, but it's an important issue. Around 89% of all prescriptions issued in England are free because people qualify for free prescriptions, whether that's because they're on income support, universal credit, job seekers allowance, pension credit. So the vast majority of people getting general prescriptions are entitled to free prescriptions. But for women who often going through the menopause often don't fit those criteria, we fully recognise that it's a very, very high cost, particularly for women who are on 2 hormones or may have multiple products that they need dispensing. And that is why we are committed to, by April next year, to introduce the prepayment certificate. It's a bespoke one for HRT. It's very different to the prepayment certificates that exist for general medicine right now. But there are some steps that we have to go through. We are expected to consult with the professional bodies involved. There will be changes to both dispensing and prescribing. There's a statutory instrument that needs to be laid in order to make those changes happen. And there's also IT changes to actually make it happen in practical terms so that women, when they turn up to get their prescription, it's actually there in the chemist for them to collect. So we're not making excuses, and it's by April next year, not from April next year. So if we can do it any quicker, we absolutely will. And it will be £18.70 for all HRT products, whether that's the 2 hormones, whether that's multiple products, and that will be a considerable saving for women in terms of the cost. In terms of the HRT supply, that has been a challenge, and we've seen over a 30% increase thanks to all the campaigners raising the profile of the menopause, but also the benefits of the HRT, breaking those taboos where GPs and doctors were often worried about the safety of HRT, and being able to explain that some of that research that was around 10, 15 years ago is out of date, and it's a safe and effective product for many women. So there has been a huge increase. We've met with trade suppliers, manufacturers, pharmacists to discuss some of the challenges they're facing and to try and overcome them. And we've actually, over the 70 products that are available, we're now down to pressures on about 3 or 4 of those products. And even with those, we're seeing significant progress. For the Honourable Member for Belfast South, who asked about an update specifically, Maddie McTiernan, who's the head of HRT supply, updated the task force this week. We are making good progress. There's some commercially sensitive information which we can't share, but manufacturers are really stepping up to the plate to produce extra supply. It's not about meeting the demand now. Demand's going to continue to grow, and we need to future-proof that to make sure that in 6 months' time we're not in the same situation. The prepayment certificate will also help. So women will no longer have to try and get 3 or 4 months prescription to try and keep that cost down. they'll be able to get a monthly supply and not have to pay the increased cost for doing that, and that will help manage supplies overall. We've also introduced the 3 serious shortage protocols for the 3 products, so that we can manage the amount that's being dispensed and have better stock control, but also give powers to pharmacists to be able to give alternative products, which is not always ideal, because I know some women notice very instantly, even if it's the same drug, if it's a certain change in manufacture even, they notice the difference in the effect. So that's not ideal, but it is helping us get through this acute period where we'll be able to control stocks better in the longer term. So we will be updating colleagues much as we go through with this, but Maddie and the team from Bays have been helping us hugely in terms of that. The UK Menopause Task Force, which has obviously been set up, was one of the asks from the Honourable Lady. It wasn't a government suggestion. We agreed to that. We have had our second meeting, and there's 4 key areas where we want to make recommendations, and that will be on education. That's education for women and men and boys and girls, but education for healthcare professionals too. It is going to look at the workplace, it is going to look at health provision, and it is going to look at research and in areas like testosterone, where we need to be breaking some barriers there. With the short time I've got, just to touch on the workplace, it is absolutely crucial, and one of the key things I think about the task force is it isn't just about health. We've got a Bays Minister on there, we've got an Employment Minister on there. We're going to invite, at the suggestion of the Honourable Lady, a Minister from Justice as well, so that we are reaching out to all women who are affected by the menopause. And I am really pleased that the Civil Service led the way this week when we signed the Wellbeing of Women Menopause Work Pledge. That's not just to help women in the civil service who are going through the menopause, it's to show other employers the sorts of small changes, like the pink fan from the Honourable Gentleman from Strangford, the small changes that can make a big difference, but also so that women feel confident and employers feel confident being able to have those discussions at work. Because, you know, as the Honourable Lady from London and City's Westminster said, you know, this is the prime of life, and we've got women with extraordinary experience and talent that we should be harnessing and not letting go. We are really serious about improving GP training. It has been difficult for them to often get the kind of that specialist advice and support. It's a growing area, but the GMC are introducing in their licensing assessment, as part of their assessments, that the menopause will be included as part of their assessment, and so that will be a core part of training. And the NHS England menopause programme is going to be producing resources for all types of healthcare professionals, so that we can make sure that people are trained. I know I've got to let the Honourable Lady, I think, to come back. So the NHS itself is setting up a training programme in terms of making sure that GPs, nurses, at every point that a woman approaches the health service, will get that specialist training that they need. And just also on the women's health strategy, it is coming forward. I would rather spend the time getting it right than rush it through just to meet a deadline. But we are talking weeks away from publishing it. We've already published our vision. We've already published the findings from the consultation, and so the strategy will build on that. And the menopause will be a priority area within that document, and we will also be announcing the Women's Health Ambassador very shortly, who will be pushing, holding my feet to the fire, as well as the Honourable Lady from Swansea East as well. So I hope that I've reassured colleagues that we are doing so much work in this area. The debates like this are not just about holding me to account, it's about breaking the taboos, doing the light bulb moments for women across the country, as the Right Honourable Member for Romsey and Southampton North said. And I look forward to working with colleagues across the House in all 4 nations to improve the experience for women.